Good morning, class. So last time we have started the chapter that is cholinergic agents. In that we have seen some introductory part regarding the cholinergic agents. Okay. So I will just take overview what we have seen in the last lecture. So in that we have seen the structure of acetylcholine. Then we have seen different receptor, that is the cholinergic receptor, that is M1, M2, M3, M4, M5. What are the locations of these receptors, where they are present, that we have seen. Then nicotinic receptor, there are two types, NM and NN. Okay. Then we have seen some examples of some agonist agents which can bind to the receptor, that is the muscarinic receptor, and facilitates the activity of acetylcholine or acetyl related activity. Second one, we have seen some the examples of antagonist, that is the anticholinergic agents which binds to the receptor and block the activity of acetylcholine. So muscarine, pilocarpine, these are two naturally obtained cholinergic agonist agents, while methacholine, methanicol, so these are the synthetic cholinergic agonist. Then we have seen the examples of antagonist, that is atropine and belladonna. So these are the antimuscarinic agents which are obtained from natural resources. Then we have seen some introductory part for the SAR of muscarine, how the changes in the structure of muscarine, it is the acetylcholine, increases or decreases the activity, that we have seen. Okay. So we have seen the SAR. So according to the SAR, so that is the structure of acetylcholine. So what the SAR tells, or what the scientist tells, is that if you want to develop a drug which is agonist, then that agonist having similar kind of structure what we can see regarding the neurotransmitter. So based on that philosophy, or based on this thing, they have developed the cholinergic agonist agent depending upon the structure of acetylcholine. Okay. So why such type of structures are required? Suppose here NH2 is there, here COH is there. Okay. Suppose this is receptor, this is drug. So if such binding between the receptor and the drug takes place, then only they will show the activity. Okay. So if you have to modify the drug or the structure of drug, that is the agonist agent, what you have to do, you have to maintain similar kind of functional group, so that that functional group can bind to this part of the receptor. So I am giving just one example. If COH is the part of receptor, NH2 is the structure which is present in the drug or the neurotransmitter, then the drug which we are developing, it should have the similar kind of structure what we can see in the acetylcholine. Okay. So if here quaternary is formed, that means most of the agonist drugs, they should have this kind of structure, so that the binding can be easy with the receptor and it can produces the activity. Then what we have studied is that the acetylcholine having quaternary ammonium, that we can see in the structure, and due to the quaternary ammonium, it is difficult for the acetylcholine to cross the blood-brain barrier, as well as due to the presence of ester, it can be undergo hydrolysis reaction by the enzyme butyryl, and before it reaches to the blood-brain barrier, before, as soon as it enters the peripheral enzyme, it causes the metabolism of this acetylcholine. That's why we cannot give a drug named as acetylcholine to the patient, because of these two reasons. That is, one is it doesn't have the capacity to cross the blood-brain barrier, and second one, it can undergo metabolism by the enzyme called as esterase, and due to that the duration of activity also decreases and it is difficult for them to enter into the ANS and to show its activity. That's why we have to develop a agonist drug. Okay. So this is the structure, or you can say this is the basic structure for the development of agonist drug. So the main part is regarding these quaternary ions. So here we can replace the nitrogen with sulfur, phosphorus, arsenic. But it is found that when we are replacing the nitrogen with these atoms, it will reduces the activity. So for the most important part regarding this quaternary ion is that the nitrogen should have the positive charge, and along with the positive charge it should have 3 methyl groups. So here you can observe there are 3 methyl groups, 1, 2 and 3. So that 3 methyl group must be present in the structure for the better activity. If we can increase or decrease the number of carbons, that means if we are replacing CH3 and we are replacing with the hydrogen, or we are adding CH5 or propyl group, so what happens due to the addition of such groups? The activity of that drug decreases. Okay. Then the ethylene bridge we have seen. So we have to maintain the ethylene bridge, that is the 2 carbon atom chain in between this oxygen and this nitrogen. That means we have to follow the rule of 5. That rule of 5, what it states? The last hydrogen which is present on the nitrogen and this carbon of the acetoxy group, that should have minimum 5 number, that should have the 5 number of carbon atoms. So if we increases the number of carbon in between, so that rule doesn't obey. That's why the activity will be decreased drastically. Okay, so that's why there must be presence of 2 carbon atoms or the ethylene bridge between these two. Then in the acetoxy group, if this acetoxy group is present, it can undergo metabolism by the enzyme esterase. Hence, this group is not actually necessary for the activity. So we can replace this group, can be phosphorate group, can be carbamate group, we can add ether, can be add ketone, can be. So this acetoxy group we can replace with another agents. But the main thing is that we have to maintain the oxygen in that group. It is not like that we have to remove the oxygen. The oxygen must be removed in the structure. So it can be the carbamate structure, it can be the phosphorate structure, it can be the ether, it can be the ketone, where there is a presence of oxygen takes place. Okay. So here the modification of quaternary ammonium group. So what we have studied, or what I have told just, if we modify the quaternary ammonium group, as this nitrogen having a positive charge, this positive charge, that means the quaternary ammonium or the quaternary nitrogen is required for the activity. If we are replacing the nitrogen with phosphorus, sulphur or any other group like arsenic, then it will decreases the activity. That's why this group, that is the nitrogen with positive charge, it is required for the activity. Okay. So it forms the ions, so there must be the presence of ions, so there must be the presence of 3 methyl group which is attached to the nitrogen. And the second part regarding this is that there are necessary for the 3 methyl groups to show the agonist activity. If we are replacing one of the methyl group with the hydrogen or by higher alkanes like C2H5, C3H7, then it causes the loss of activity. That's why this 3 methyl group is necessary for the activity. Okay, so these are the examples. What happens if sulfur is present, phosphorus is present, arsenic, though they are providing the positive charge species or ions, they reduces the activity if we are replacing nitrogen with oxygen or sulfur or phosphorus or any arsenic. So what is the conclusion, or what is the SAR main part regarding that, regarding the quaternary ammonium? There must be presence of charge, there is a positive charge, and it should be on nitrogen only, and this nitrogen must have the 3-methyl group to show the activity. So that is the some part which is regarding with SAR of this quaternary nitrogen. So if the R is methyl group, it produces the active drug. If it is ethyl group, then it becomes antagonist. If propyl or hierarchies, then the drug becomes inactive. And only one of the R is ethyl or propyl. It is active, but it is less potent as compared to the acetylcholine. And if it is hydrogen, then the activity goes on decreasing. Then from moving from the quaternary ammonium or quaternary nitrogen, it is the in between that there is a 2-carbon chain is present, that is called as ethylene. So as per the rule of 5, it states that there should be no more than 5 atoms between the nitrogen and the terminal hydrogen. So this nitrogen and this terminal hydrogen, in between them there must be 5 carbon atoms. It should not be 6 carbon atoms or 7. When it will happen? If we are increasing this chain. If instead of ethylene, propylene, butylene, if we are adding such a carbon atom in between that, then it increases the number of atoms between the hydrogen and nitrogen. So that is the rule of 5. Another one is that this carbon is alpha carbon, this carbon is beta carbon. If we are doing the methyl substitution at beta carbon, then the compound is methacholine and it is used clinically, and it gives the more activity towards the muscarinic receptor or more selectivity towards the muscarinic receptor. So if we are going for the beta substitution, if we are going for the alpha substitution, then it becomes more selective towards the nicotinic receptor. But these drugs, they are not generally used clinically. So if beta substitution is there, muscarinic or the muscarinic receptor selectivity. If alpha substitution is there, it gives the nicotinic receptor selectively. So when muscarinic receptor selectively drugs is formed, they are having the clinically active, or they are clinically active. But when if they are having the alpha substitution, then becomes clinically inactive drug. So this is the example methacholine. You can observe there is a methyl substitution at beta position. Draw the structure of methacholine. Due to the beta substitution, it becomes more selective towards the muscarinic receptor, and due to the increase the selectivity towards the muscarinic receptor, such drug it can be used clinically. While the other drug which is draw below the methacholine, it having the substitution at alpha carbon, and due to the substitution at alpha carbon, the drug becomes more selective towards the nicotinic receptor, and due to the selective towards the nicotinic receptor, such drugs it is not used clinically. So if alpha substitution, nicotinic receptor selectivity, beta substitution, muscarinic receptor selectively. Then third and last part regarding the SAR, that is the modification of acetoxy group. So it is found that if acetyl group is present, it can more prone for the metabolism by the esterase. And substitution of acetyl group, that is this group with higher groups such as propionyl, butyryl, it will reduces the activity. Another thing is that the ester group is not necessary or not mandatory for the activity. Only the oxygen present in that group, it is necessary for the activity. So this ester group we can replace with the ether, ketone, phosphonate group, carbamate group, so that it will avoid the metabolism of a drug and the duration of activity of drug will be increased. Okay, so these are some carbamates, ethers, ketones. So such modifications we can do, and due to the modifying such drugs, it can reduces the hydrolysis. So first one is carbamate, second structure is the ether, third one is the ketone. So if we modify it into this type of structures, then ester converts into this type of structures, So it does not undergo the hydrolysis, or it reduces the hydrolysis reaction. Okay, so in brief, here we are giving the SAR of cholinergic agents or muscarinic antagonists. So just go through it. What I have told, that it is given in the very short form, so it is better for you to understand. Presence of nitrogen in quaternary ionic form. 3 methyl group is necessary. Rule of 5. In the methyl group, beta carbon it makes muscarinic selective, alpha carbon it makes nicotinic selectivity. Ester group isn't necessary for the activity, it can be replaced with the carbamate, ketone or ether, so that it can resist the hydrolysis and it can maintain the activity. The drugs other than acetylcholine that produces same kind of effect, that is they bind to the muscarinic receptor and produces the effect similar to the acetylcholine. Such drugs are with greater intensity. Such drugs, or the example of drugs are methaqualone, carbachol, butanicol and pilocarpine hydrochloride. So what is the mechanism of this drug? So they act directly by binding to the muscarinic receptor as an agonist, and they produces the activity similar to the acetylcholine. So that is the mechanism of action of this type of drug. So agonist means which can bind to the receptor and produces similar kind of activity. So like this, these drugs they bind to the muscarinic receptor and produces similar kind of activity what we can see with the acetylcholine, but the intensity or the potency of this drug is more as compared to the acetylcholine. So why we are giving this drug? Because acetylcholine having some drawbacks, that's why we cannot give acetylcholine as a drug due to its it cannot cross blood-brain barrier as well as it undergo metabolism. So due to these things, instead of acetylcholine we can give the agonist drug which can produces the similar kind of effect with more intensity. So methaqualone, butanicol, carbachol, pilocarpine, such drugs can show similar kind of activity and greater intensity. Okay, so this is the structure of methaqualone. Please write down the structure of methaqualone. So if you observe the structure of methaqualone, what you can find out, all the structure is same, only here beta methyl substitution is there. Due to beta substitution, it becomes more prone or more selective towards the muscarinic receptor rather than nicotinic receptor. And as you can find out, this carbon having different 4 atoms attached to this carbon center it becomes asymmetric center, chiral center. Hence it produces different isomers. So one is the R enantiomer, second one is the S enantiomer. So out of these isomers or enantiomer, the S enantiomer is 240 times more potent as compared to the R enantiomer. As well as the R isomer is weak inhibition of acetylcholine degrading enzyme called as acetylcholine esterase. Thus, this is given as a racemic mixture, that is the RS methacholine chloride. Okay. Then what is the use or what is the therapeutic use of these drugs? So this is used to induce bronchospasm in asthma patient for the purpose of verifying the diagnosing asthma. So for the diagnosis of asthma, we can use these muscarinic agonist, that is the methacholine drug. The next drug, that is the carbachol. So here you can observe in case of carbachol, so methaqualone, here you have CH3 or ester group. Here in carbachol you have NH2 group. So due to the presence of NH2 group, the drug becomes carbamate analog of acetylcholine, and due to that it is resist to the hydrolysis by the enzyme esterase. So it is very resistant to hydrolysis both by GI acid and acetylcholine esterase. but it is not selective to the muscarinic as well as the nicotinic receptor, as there is no any substitution which is present on the alpha carbon or the beta carbon. Both are the free. There is no any substitution on alpha carbon or beta carbon, and due to that it is not selective for the muscarinic receptor and non-selective for the nicotinic receptor. But due to the presence of carbamate group, these drugs resist to the hydrolysis process. Hence, the duration of activity of these drugs are more as compared to the methacol. Then, what is the use? This drug it is used in the treatment of glaucoma and constrict the pupils during the eye surgery. Next drug we can see is the butynyl chloride. So draw the structure of butynyl. Check what is the change. Carbachol, butynyl. Okay, draw the structure butynyl. So you find that in the butynyl structure we have carbamate group. So due to the presence of carbamate group, it is resistance to the hydrolysis reaction. As well as on beta carbon there is a CH3 group on beta carbon, and due to the presence of this beta CH3 substitution, this drug is more selective towards the muscarinic receptor as compared to the nicotinic receptor. So in case of this drug, it is the carbachol, there is a similar kind of structure, only the absence of this substitution. But in case of butynyl, there is a substitution is present on the beta position, on the beta carbon. Hence, the drugs are more selective towards the muscarinic receptor as compared to the nicotinic receptor. So what is the use? They are generally used to treat the urinary retention resulting from general anesthetic agents, as well as to treatment of gastrointestinal atony, that is the muscle loss, their peristaltic ability. So that is called as the gastrointestinal atony. For that, the butynyl chloride can be used. And next drug, that is the pilocarpine, or you can say the pilocarpine chloride. So in case of pilocarpine, it is actually the naturally occurring drug. It is the alkaloid derived from a plant, and it doesn't look like a similar kind of structure what we have seen in acetylcholine, but still it having the cholinomimetic activity. So it is not selective to the muscarinic unlike other agonists, but it can penetrate into the eye after topical application. So this is generally used for the treatment of dryness of mouth, as well as for the treatment of glaucoma and to constrict the pupils during the cataract surgery. So for that, this kind of drug, that is the pilocarpine, which is the naturally occurring agent, it can be used. Now, carbamates, they are generally resistant to the acetylcholine esterase. That is, the esterase is the enzyme. Acetylcholine means the enzyme which is responsible for the hydrolysis of acetylcholine. That enzyme is called as acetylcholine esterase. E means esterase. शेवटी A's असतं, that means it break down that functional group. So here ester H means it break down the ester. कुठलं? Acetylcholine esterase. So this drug is responsible to hydrolyze the ester part of the acetylcholine. So that enzyme is called as acetylcholine esterase. And already we have discussed, if ester group is there in the structure, it can be hydrolyzed by the enzyme. That's why we are replacing this ester group with carbamates, ketone, ether, such type of group, so that it cannot undergo the hydrolysis reaction and the duration of activity will improve. Okay. So carbamates, it generally resists to the acetylcholine esterase. So actually what happens during the regular reaction or regular process, when we are giving the acetylcholine, So this acetylcholine, it reacts with the enzyme called as acetylcholine esterase, and this acetylcholine esterase having the serine in the terminal amino acid with hydroxy group. So when the reaction between these two takes place, this binds to this part, हा पार्ट ब्रेक होतो आणि हा ऑक्सिजन आहे तो ह्या सेरीनला बाइंड होतो, and we are getting this type of structure. आणि हा ज्यावेळी बाइंड होतो त्यावेळी त्याला हायड्रॉक्सी ग्रुप, with this we are getting the remaining part is this one, and then again it forms CH3COH. So इथनं serine break होतं in presence of water molecule. So again we are getting the enzyme as it is, and it is converted into CH3COOH. So this acidic part separates, this alcohol part separates. So that is the general reaction or the normal reaction what we can observe during the hydrolysis of acetylcholine by the acetylcholine esterase. So once again we will go through so we can better understand. कुठल्याही स्ट्रक्चर मध्ये ज्यावेळी इस्टर असतं, that ester undergo the hydrolysis. So when it undergo hydrolysis, it takes place in presence of water. So it forms acid plus alcohol. So similarly, when acetylcholine it undergo hydrolysis reaction by the enzyme acetylcholine esterase, it also forms the two type of structure, that is the acid and the alcohol. So how the reaction takes place, or what is the step for the reaction? So this enzyme, that is the acetylcholine esterase, it having the terminal serine amino acid, and that serine amino acid having the hydroxy group. So this reacts with the acetylcholine, and breaking of this part takes place, and this serine binds to this part. So you are getting this type of structure, and it separates in the form of this alcohol. And in the next step, due to the water, again this serine bond breaks, this serine hydroxide separates, so the enzyme it gets separate, it remains as it is, and we are getting the CH3COH, that is the acidic part of the acetylcholine. So in this way the normal reaction takes place, or the normal metabolism of acetylcholine takes place by the enzyme acetylcholine esterase. But if the carbamate is present here, if carbamate is present at this position, it is difficult for the enzyme to cause the hydrolysis of the carbamates, hence its structure remains intact. That's why if we are replacing the ester group with the carbamates ether or ketone group, then it is difficult to cause their hydrolysis, or it is difficult to metabolize such things. Okay. What is anticholine esterase? So as the name indicates, esterase means which break down the ester group, that is which causes the hydrolysis of ester group. Choline means acetylcholine, so the enzyme which causes the hydrolysis of acetylcholine, that enzyme is called as choline esterase. And anticholine esterase means the enzyme, which the drugs which are responsible to inhibit the activity of choline esterase, that drugs they are called as anticholine esterase. Are you getting my point? Choline esterase काय करतं? They causes the hydrolysis of acetylcholine. They break the acetylcholine. And anticholine esterase means, anti means oppose or the against. So this anti means these drugs they are responsible to inhibit the activity of enzyme choline esterase, and due to the inhibition of activity of choline esterase, the acetylcholine remain intact. So when we are giving the drug, that is the anticholine esterase, they inhibit the choline esterase, so that it protects the acetylcholine from hydrolysis, hence it can potentiate the cholinergic effect. Are you getting my point? So this is about the anticholinesterase. These are the drugs which inhibit the activity of cholinesterase. So the acetylcholine remain intact. It can be prevented from the hydrolysis and it potentiates the cholinergic activity. So these anticholinesterase or acetylcholinesterase inhibitor, they are generally classified into two types. It is the reversible and second one irreversible. So ते ज्या एन्झाईमला इनिबिट करतात असे ड्रग दे आर classified into two types. One is the reversible, another one is the irreversible. So as the name indicates, reversible drugs. Reversible means they can inhibit the enzyme and after completion of their work they can detach from the enzyme. So again enzyme remain as it is. Okay, that is the reversible. But already we have studied what is irreversible. Irreversible means these drugs form a covalent bond with the enzyme, and due to the formation of covalent bond with the enzyme, covalent bond is the strongest bond, so it is difficult to break that bond. Hence, once these irreversible inhibitors binds to the enzyme, it remain or it is difficult to detach from the enzyme. So it remain or the enzyme remain in the combination or in the bonding with these drugs. So enzyme does not work or enzyme does not produces its activity. So reversible means which binds to the enzyme, block the activity of enzyme for some time. After that it is detaches from the enzyme. Enzyme can work its activity after some time. But if irreversible drugs are given, these irreversible drugs they cause the binding to the enzyme with the covalent bond. So after some times also they cannot be detached from the enzyme. So that's why enzyme cannot work its own activity after some times. Okay. So the drugs which do not covalently bond or modify the enzyme, such drugs are Carbamates and Acridine. So for the examples, Physostigmine, Neostigmine, Pyridostigmine, Edrophonium, Rivastigmine, Donepezil, these are the Carbamates which comes under the reversible acetylcholinesterase inhibitor. And Tacrine, that is comes under the class of Acridine. This is reversible acetylcholinesterase inhibitor. While organophosphates and carbamates, these are the two drugs or the drugs having this type of structure. This comes under the irreversible acetylcholinesterase inhibitor. Okay, concept clear झाला. आपलं ॲसिटाइलकोलिन काय आहे, इस्टर आहे. हे झालं तुमचं ॲसिटाइलकोलिन. हे ॲसिटाइलकोलिनचं हायड्रोलायसिस कोण करतं, ॲसिटाइलकोलिन इस्टरेज हा एक एन्झाईम आहे. हेचा हायड्रोलायसिस करतं, तुम्हाला ॲसिड वेगळं मिळतं, अल्कोहोल मिळतं. म्हणजेच मेटाबॉलिझम झालं कुणाचं, ॲसिटाइलकोलिनचं. दॅट इज द वन पार्ट. हे कोण करतं, हे एन्झाईम करतं. सो आपण असे ड्रग द्यायचे की ते एन्झाईम इनहिबिट करेल. आणि जर एन्झाईम इनहिबिट झालं, एन्झाईम त्याचं काम आहे की एन्झाईम काय करणार, ॲसिटाइलकोलिनचं मेटाबॉलिझम करणार नाही. त्यामुळे ॲसिटाइलकोलिन प्रोटेक्ट होणार, त्याचं कॉन्सन्ट्रेशन वाढणार आणि त्याचं कॉन्सन्ट्रेशन वाढल्यामुळे तुम्हाला ॲक्टिव्हिटी आहे ती मिळणार आहे. सो असे कोणते ड्रग आहेत, दे आर कॉल्ड ॲज acetylcholinesterase inhibitor. So they inhibit this enzyme so that it can protect the acetylcholine. The concentration of acetylcholine will increase, it will show its activity. Okay, so they are classified into two types, that is the reversible and irreversible. Reversible means they bind to the enzyme and after some time they are detaching from the enzyme. But in case of irreversible, they bind to the enzyme, but due to the formation of covalent bond, that is the stronger bond, they cannot be detached from the enzyme and they will nearly permanently block the given enzyme. Okay, so the details regarding these acetylcholinesterase inhibitor we will see in the next lecture. Now we will stop here.